Mary Dunn is looking and feeling healthy today.
Thanks.
Part of that is because of a surgery she had back in January at Memorial Hospital. The significant procedure removed a troubling part of her colon, about which her doctors were becoming very concerned.
That lesion was coming back over and over again, and it was large enough to be of clinical concern that it would turn into cancer. And so, nipping that thing in the bud and then having a great outcome is really what we're here for.
Dr. Daniel Srikaraja is the surgeon who performed this procedure using the Davinci surgical system. He was able to remove a section of colon where the troubling polyps kept coming back.
We were able to make much smaller incisions and do everything that we would have normally done through a large, 15-inch incision through small 3/8 of an inch incisions, and people are getting better much quicker.
Perhaps even more importantly, this Beacon Medical Group doctor is one of the few, if not only in our area, able to use the Davinci to connect two healthy sections of colon together inside the abdominal cavity using that small incision. Traditional surgeries like this usually require a much larger incision and part of the procedure performed outside the body. The use of the Davinci and the skill of this team brought about not only a successful surgery, but a much easier and quicker recovery for Mary.
So I had this vision that for 4 weeks I was going to be at home basically reading and watching TV. After 2 weeks, I was out driving a little bit. Starting to walk a little bit.
Mary was born in Niles but lived most of her adult life in northern Wisconsin. Now that she's back, she says she's grateful to have access to doctors and technologies usually associated with larger cities and academic institutions.
As Dr. Dan said, when you have these advanced technologies, that is just an extra plus. Us having the staff and the doctors who are, trained to do these procedures.
These types of surgeries using the smaller incisions usually cut the post-op hospital stay by at least 30%, if not more. Since cancer runs in Mary's family and her father died from colon cancer at the age of 52, she still must get a colonoscopy once every 3 years, but that's a far cry from the worry and the hassle before the surgery of having to get one every 6 months. And by the way, that section removed turned out to be benign, but most importantly is now out of her body where it can do no harm. For Eye on Health, Bob Montgomery, WSBT 22 News. Thanks for watching. Like and subscribe to the WSBT 22 YouTube channel.